Sunscreen and bug spray, children's summer skin care. Summer is here, and we know we're supposed to shield children from the sun. There's strong evidence that early sun exposure can increase children's risk of later skin cancer, and that's true also for darker-skinned children who are less likely to burn. Boston and Miami Beach are providing free sunscreen in public places, and now New York is talking about it, too. Parents have certainly gotten much more aware about sun protection, though they sometimes feel a little overwhelmed by the variety of products and by the job of keeping up with the imperatives for proper use. And with old worries about ticks and new worries about mosquito-borne viruses, parents wonder if they should also be coating a child's exposed skin with bug repellent. But babies' delicate skin is more permeable than adults, so any chemicals we apply may be more likely to be absorbed, and their mature organs may be less able to handle those chemicals. What stays on the skin may be absorbed, but what doesn't stay on the skin doesn't shield. Dermatological toxicology involves considering the balance between wash-in, the risk of absorbing potentially toxic substances through the skin, and wash-out, the loss of protection as substances are lost by sweating or water exposure or rubbing. Both are highly complex processes, with many variables, and not necessarily well studied in young children. With little babies, the advice is always to rely on reducing exposure, on shade and clothing for sun, and on adding screens and netting to keep the bugs off. Both the Food and Drug Administration and the American Academy of Pediatrics emphasize that babies under 6 months should be kept out of direct sunlight, protected with shade, shielded with sun hats and protective clothing when they do have to be out, rather than relying on sunscreen. Babies' skin surface is large in proportion to their body volume and their internal fluids, putting them at high risk for heat and dehydration. So make sure they are drinking and wetting their diapers regularly. Adults and children alike are advised to avoid the hours of maximum exposure, to stay out of the sun between 10 and 2, and to avoid going outside at dusk in areas with lots of mosquitoes. But of course, that isn't necessarily easy. Sun hats and protective clothing are important for older babies and toddlers, and so is avoiding those peak hours. For children under 2, the rule of thumb in this age group is clothing first, said Jacqueline Thomas, an assistant professor of dermatology and surgery at Nova Southeastern University in Fort Lauderdale, who is the senior author on a commentary reviewing pediatric sunscreen and sun safety guidelines published last year in the journal Clinical Pediatrics. Dark colors and more tightly woven fabrics are more effective.